Hello and welcome to our new topic. Today we will discuss the pharmacological management of nausea, vomiting, and gastrointestinal motility disorders. These are extremely common clinical problems encountered in medical practice, from simple gastroenteritis to chemotherapy-induced vomiting. Although they appear symptomatic, they are actually complex neurophysiological processes involving the brainstem, vestibular system, enteric nervous system, and multiple neurotransmitters. Therefore, rational therapy depends on understanding receptors and pathways rather than memorizing drug names. So, let's start. By the end of this session, you should not only be able to classify antiemetics and prokinetics, but also explain their mechanisms of action, recognize adverse effects and interactions, and apply this knowledge to choose the correct drug in specific clinical scenarios. Always remember, pharmacology is about selecting the right receptor target for the right clinical cause. Vomiting is coordinated by the vomiting center located in the medulla. It acts as an integration hub that receives signals from multiple anatomical sources. Importantly, this center does not initiate vomiting randomly, it responds to chemical, mechanical, and psychological stimuli. Therefore, antiemetic therapy must target these inputs rather than the act of vomiting itself. Signals from the cerebral cortex explain anticipatory nausea. Patients may vomit simply by sight, smell, or thought, especially during chemotherapy. This is why benzodiazepines sometimes help, not because they block receptors in the gut, but because they reduce cortical anxiety and conditioned responses. Motion sickness originates from vestibular nuclei and uses histaminergic and cholinergic pathways. This explains why antihistamines and antimuscarinics are especially effective here, while dopamine or serotonin blockers are less useful. Thus, drug choice depends on the source of the stimulus. Peripheral irritation from gastroenteritis or toxins activates vagal afferents that stimulate serotonin release. These signals strongly activate 5-HT3 receptors. This is the rationale behind using 5-HT3 antagonists in chemotherapy and severe gastroenteritis. The CTZ lies outside the blood-brain barrier and directly senses circulating toxins, drugs, opioids, and anesthetics. Because it is chemically sensitive, it is rich in D2, 5-HT3, NK1, histamine, and opioid receptors. Most modern antiemetics act here. This slide also highlights the neurotransmitters involved. Acetylcholine, histamine, dopamine, serotonin, and substance P. Multiple transmitters explain why combination therapy is often required in severe nausea. No single drug blocks all pathways. Antiemetics are classified by receptor antagonism. H1 blockers treat motion sickness. M3 blockers reduce vestibular cholinergic signaling. D2 blockers act mainly at the CTZ. 5-HT3 blockers prevent vagal serotonin-mediated vomiting. NK1 blockers inhibit substance P. This classification reflects physiology directly. Cannabinoids act centrally and modify emetic perception. Prokinetics improve gastric emptying and reduce nausea indirectly. They stimulate cholinergic or serotonergic activity or block dopamine inhibition. Thus, some drugs treat nausea not by blocking vomiting, but by correcting motility. No single antiemetic is ideal. Efficacy depends on cause. Understanding the underlying pathway is more important than drug memorization. This is rational pharmacology. During active vomiting, oral drugs are ineffective, so IV or rectal routes are required. Always treat the cause first. Symptomatic therapy alone is insufficient. Here, antihistamines and antimuscarinics are most effective because they target vestibular pathways. Dopamine antagonists are less useful. In gastroenteritis, dopamine antagonists such as domperidone are useful. Domperidone is preferred because it does not cross the BBB, thus causing fewer extrapyramidal effects compared to metoclopramide. Pregnancy nausea should be treated conservatively. Drug exposure must be minimized. Doxylamine with vitamin B6 is preferred because of safety data. Always prioritize fetal safety over aggressive symptom control. Postoperative and chemotherapy-induced nausea are severe and multifactorial. Combination therapy is often required. 5-HT3 antagonists, NK1 antagonists, cannabinoids, and corticosteroids. Sedatives reduce anticipatory components. This is an example of multimodal pharmacology. Serotonin release from damaged enterochromaffin cells makes 5-HT3 antagonists first line. Corticosteroids enhance efficacy. This demonstrates pathophysiology-guided therapy. Now we will talk about the drugs which control forward motility of the gastrointestinal tract. Such drugs are called prokinetics. The enteric nervous system regulates peristalsis using serotonin-mediated signaling. 5-HT4 stimulation enhances acetylcholine release, increasing motility. Understanding this physiology explains how prokinetics work. Release of serotonin by enterochromaffin cells from gut distension stimulates submucosal intrinsic primary afferent neurons via 5-HT1P receptors and extrinsic primary afferent neurons via 5-HT3 receptors. Submucosal IPANs thus activate reflex peristalsis and secretion. Stimulation of 5-HT4 receptors on presynaptic terminals of IPANs enhances release of acetylcholine and CGRP, promoting reflex activity. Among the prokinetic drugs, 5-HT4 receptor stimulants are the most important and specific. These drugs stimulate peristalsis through presynaptic facilitation. Cisapride and tegaserode were withdrawn due to cardiac toxicity, reminding us that pharmacology must balance efficacy with safety. Dopamine inhibits cholinergic transmission. Blocking D2 receptors removes this inhibition, increasing motility. Hence domperidone and metoclopramide enhance gastric emptying, and are among most commonly used drugs in this regard. Cholinomimetics directly stimulate contraction but cause systemic side effects. Motilin agonists like erythromycin stimulate migrating motor complexes. These are useful but limited by tolerability and hence not commonly used. Thanks for watching. Don't forget to like, subscribe, and share. Happy learning!